This presentation is over the Walk to Wellness program. Hi, I'm Elena Price. I am a senior public health major at Georgia College. I had the opportunity this spring semester to be the community outreach and benefit intern at Good Samaritan Hospital in Greensboro, Georgia. My plans post-graduation right now are to find a job in a hospital setting, specifically doing clinical research or patient quality and safety care. And so I look interested and I'm motivated to get into the public health field.
Hi everyone, my name is Claire Elliott Gower. I'm a senior at Georgia College and I'm graduating with a Bachelor of Science in Public Health in early May. I am still on the job hunt. I have plans to work in healthcare administration following graduation. I've had a lot of opportunities through work and through internships to work in this field, and I've just really gained a passion for it and an interest in it, and that's what I want to pursue. And through my internship that I'll talk to you more about in a little bit, I realized that I really like the fast-paced and big environment of the hospital, so I'm hoping that I end up in that setting. Just to give you guys an overview of our presentation, to give you an understanding of what we're going to talk to you about, we're just going to tell you about our internship site, about the community, the area served, and the needs of that community. And then we're going to go into more detail about the big project that we did while we were there, which was a 6-week walking program. We're going to tell you about the planning of this, the implementation, evaluation, and just all the details of this project that we had the opportunity to put on. So our internship site was St. Mary's Good Samaritan Hospital in Greensboro, Georgia. The top picture is actually a picture of the hospital. It's gorgeous and really small. And then the bottom picture is a picture of Lake Oconee, which is in the Greensboro area. I'll go more into detail about this later, but it's kind of a unique community because it's got the lake, which attracts a lot of retirees. So there's a lot of high income retirees in the area who do elective surgeries at the hospital and bringing money to the hospital. And then there's also a lot of lower income and poverty in the area for people that are locals of this area, and they live further from the lake, more towards the downtown area of town, so there's kind of a divide that you see in the community, which can make it hard to get an understanding of the needs of the community because the two groups can be so different. But the Community Health Needs Assessment does this and looks at all the demographics, all the needs, and finds, what the biggest needs in the community are, and what needs are similar between those two groups of people. So Good Samaritan is a 25-bed acute care critical access hospital. So it's a really small hospital. Most hospitals are hundreds of beds. And it was really nice for us to have this smaller setting for our internship. We actually got to bounce around all the different departments, and spend time in the emergency department, in PT, in radiology, in surgery, in patients' rooms, and just get an understanding of all the different departments, meet all the department heads, and spend time in all these areas and see how they work together. And I don't think we would have gotten this opportunity had we been in a larger hospital. It's just kind of harder to make that actually happen, harder to communicate between the departments. So I was really grateful for that at this small hospital. And St. Mary's Good Samaritan is under St. Mary's Healthcare System. So that's the larger system that has 3 hospitals, one in Athens, one in Livonia, and then the one in Greensboro. And then it also has countless other healthcare offices, like outpatient and wound care, stuff like that. And St. Mary's Healthcare System is a member of Trinity Health. So that's the really large organization that has hospitals and healthcare systems all around the country. Trinity Health is a large Catholic healthcare organization. And just to kind of give you an idea of how things run over there, St. Mary's mission statement says, "We, St. Mary's Healthcare System and Trinity Health, serve together in the spirit of the gospel as a compassionate and transforming health presence within our community." And you really, really see this mission in everything that they do there. I had the opportunity to see it. Not only do they just, countlessly bring this up, always bringing it into the projects that they're working on, the meetings that they're working on, their mission and their vision, but they also just care this way. And you can see that Every morning they start with a Bible verse on the speaker, on the loudspeaker, and it's just normally kind of for, all the patients hear it, all the staff hears it, and everyone really takes the time to stop and let this time and have a minute to reflect on this. And just normally about like how, faith can be in health and help you with healing, and just it's really how they run their business there. So for our internships and responsibilities, our site supervisor was Bria Brown. She works in community benefits and outreach. She's actually a Georgia College alumni. She graduated really recently, and she's been working for 5 years at Good Samaritan. She actually started as a tech in the emergency department and realized that wasn't for her, and then made her way over to community benefits and outreach. It was really nice having her. She's really young, and she had just graduated from Georgia College, just been through her internship at St. Mary's Good Samaritan. So she had a really great understanding of, what life is like for us right now, and what was beneficial for her going through her internship and what was hard for her. And she was really understanding and worked with us awesome. And Bria, during my internship, told me, I said, what's a typical day look like for you? And she said, no day is the same for me. And I really found that true throughout my internship. It's really just what's going on in the community this week or today. What needs to be addressed today? Where can I help? And really every single day is different. So some of our responsibilities were definitely program planning. So we'll tell you more about that. We're going to tell you about the Walk to Wellness program that we planned, but we also planned several smaller events and just meetings, and got the opportunity to use what we've learned in school and bring it into program planning in an actual hospital scenario. We also frequently attended community events. And Bria also serves on many boards like the Boys and Girls Club Board, Poverty Strategy Committee, and Family Connections Board. And this was definitely some of my favorite parts, was being on these boards, getting to sit in on these meetings, because this was just all the community members coming together, or a lot of community members coming together from different nonprofits, different businesses, different healthcare organizations, and bringing their resources together, bringing their minds together, and tackling an issue in the community together. And it was really cool to see how people can work together and how much that can be helpful rather than trying to have one organization tackle on an issue by themselves. Bria also worked with hospital department directors and was a source of communication between them. And we were able to kind of bounce around between different departments and get to meet all of these directors, and everyone was super helpful with us. So a little bit about the community served. So St. Mary's Good Samaritan serves Greene, Hancock, Morgan, Putnam, and Taliaferra counties. Greene County is primarily served just because it's right in Greene County, so that's the closest in proximity. And a little bit about Greene County: it has a population of 17,281. Population is 57.5% white, 34.6% African American, 6.1% Latinx, and 1.8% other. And 17% of the economy is living in poverty. So that is a really high number. And like I said, that would be kind of more the locals that are living in the downtown area. And then there's this contrast with the really wealthy retirees who are living on the lake. So the top health needs. So actually the hospital does a community health needs assessment every year. And this is really helpful. This is really extensive. And they go into the demographics of the community of all the different areas and really specific data about the health needs in all these communities. So the top 3 health needs were cardiovascular health, nutrition, diabetes, and obesity, and behavioral health. And I'll go into more detail about these. So cardiovascular health is ranked number 1 in the 2019 Community Health Needs Assessment that the hospital provided for the community. Cardiovascular disease proportionally accounts for the most deaths in the area, and that can be a lot of different things that are encompassed under cardiovascular disease. Cardiovascular disease is linked to many other health conditions, many of which are preventable. And within that area served, more than 1 in 2 people report hypertension in their household, which would be one of these health conditions that's linked with cardiovascular disease. So behavioral health, I'm going out of order here because I'm actually going to go more into detail about diabetes, and then go into detail about the other two later. So this is actually the top third, um, the third health concern for Greensboro. Um, this need includes mental health and substance use disorder. The health need is increasing rapidly in the community, and within this health need, suicide and drug overdose were the leading causes of mortality. 1 in 4 people reported depression in their household, and 1 in 3 reported anxiety in their household. Um, we actually had the opportunity to definitely see this a lot with the patients that would come into the emergency department and have to be under a 24-hour hold and have to be in a room with, nothing they could harm themselves or others with. These were frequently coming into the hospital, and there was only one room actually designated in the hospital that was deemed appropriate for these people, and there would be a lot of times where there would be more than one person that needed this at the time. So that was a big issue within the hospital, and it just showed that this is such a big issue in the community, and that'll be definitely something that they look at in the next year's community health needs assessment, and in how they need to expand the hospital and changes they need to make within the hospital. And due to the comorbidity of mental health and substance use disorder, the categorization of the two together is really important, and they need to be addressed together, which is why in this example they did in the community health needs assessment, they put these together. So lastly is nutrition, diabetes, and obesity. And this was actually ranked second in the community health needs assessment. And I'm doing this one last because I'm going to go more into detail about this disease now and how it affects the community. And then we're going to go later into the others because we actually did a talk to the community about the other two. So this health problem includes food security and access to healthy food, type 2 diabetes, and obesity. More than 1 in 3 individuals in the service area is obese. There has been a 27% increase in obesity over the last decade. Emergency department visits for diabetes exceeded the state average in all areas served. We constantly saw that coming into the emergency department and what an issue that was for people. And in Greene County, these visits accounted for twice the state average. So it's really a bigger issue in Greene County than in many other places in the state. So this is definitely something that they have tried to address in their programs and will continue to. And Greene County and the hospital was actually used to be able to provide a program on diabetes prevention and how to manage diabetes, but there's been new management at the St. Mary's in Athens, so they were unable to continue this work. So they're kind of looking at new ways to approach this until they can reestablish that program. They believed that it was making a big difference, and it's really unfortunate that it had to stop. So they're kind of looking at new ways to approach this. So just an overview of type 2 diabetes. Type 2 diabetes is a chronic condition which affects the way one's body metabolizes glucose. And people with type 2 diabetes do one of two things. They either resist the effects of insulin, or they do not produce enough insulin to maintain normal glucose levels. And insulin is a hormone that regulates the movement of sugar into your cells, which is really important for energy and a lot of other things. And there's no cure to type 2 diabetes, but there's a lot of ways to manage this disease and to prevent this disease, which is the goal within the community. Medication, insulin needs to be used in a lot of cases, and there just needs to be education on how to use these medications properly to manage the disease. That's what a lot of the cases that come into the emergency department is improper use of medication or insulin, or just no use when it needs to be in place. And also diet and exercise are huge in the management and prevention of type 2 diabetes. So some diabetes risk factors and potential complications. So risk factors include weight. The heavier you are, the more likely you are to develop type 2 diabetes. Fat distribution. So with fat distribution, if you carry the majority of your fat in your abdomen, you're actually at a greater risk. Inactivity, the less activity you have, the greater your risk of type 2 diabetes. Exercise helps to control your weight, which helps to prevent or manage this, and also uses up glucose as energy and makes your cells more sensitive to insulin so that they're using that the way they need to be. Family history, if you have a parent or you have a sibling with type 2 diabetes, you're definitely at an increased risk. Race. There's not a lot of research on why this is the way that it is, but Blacks, Hispanics, American Indian, and Asian Americans are more likely to develop type 2 diabetes than white people are. Age. Risk increases as you age, especially after age 45. So it's just important to target this if you're in that age group, and to just take preventative measures. And potential complications that can rise with type 2 diabetes if it's not managed properly are heart disease, nerve damage, kidney damage, eye damage, and hearing impairment. And this is just a few of them, but there's a lot of potential complications that can occur. So some symptoms of diabetes are increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, and frequent infections. And the benefit of walking on type 2 diabetes. So this would be just some insight into why we chose this walking program to help the community in tackling this health issue, which is such a huge problem in the community and one of the top health needs according to the CHNA. So physical activity is key in the prevention and management of type 2 diabetes. There's countless studies that do just like exercise only as medication for type 2 diabetes, and it's huge in the prevention and the management. Regular physical activity improves blood glucose control, and interventions combining walking and weight loss have been shown to lower type 2 diabetes risk by up to 58% in high-risk populations. So that's kind of like with walking consistently 30 minutes every single day, which is what we were trying to establish in the community, comes weight loss and comes that lowering your risk. And regular walking also shows to limit risk of long-term complications of diabetes. So if it's someone who already has diabetes, they're past the prevention, this can help them to just limit the complications and to avoid the complications that can be really serious health issues to stay healthy.
Segment of this presentation is going to cover the Walk to Wellness program. We're going to get a little bit more in depth into the planning, implementing, and evaluation of our experience with the program. But to get us started, so before we got started on this program, Bria Brown, our site supervisor, gave us a rundown of how the spring semester looks like for her, the events and programs that are implemented in Greensboro County. And so we heard that she wanted to take off the Walk to Wellness program because she didn't have the passion for it anymore, to be quite frank. And we saw this as an opportunity to revamp it, bring a creative element to it. She expressed that participants in the past were motivated in the beginning and then all drive left. They didn't start showing up. They weren't interested in the opportunities that the program had to offer. So Claire and I, felt confident that with the classes that we took, like community health, intro to public health, health promotion and program planning, and then methods of health promotion, we really felt that we had the resources and knowledge to take on a project like this, to plan and implement and evaluate the Walk to Wellness program. And so in doing that, we also wanted to be creative for the program to get participants excited about the program again, and just know that it's not going to be like it has in the past. So next we're going to go into the planning. So during this time, we really wanted to be as detail-oriented as we possibly could, especially with the resources and the education that we have. We really wanted to be able to apply it. So during this planning process, we're going to be talking about our intervention justification, our vision, our goals and objectives, promotional materials, and our timeline. Okay, so our intervention justification for Good Samaritan Hospital and Oconee Valley Healthcare, we believed that the lack of physical activity in the community is a contributing factor to these health concerns that are listed on the slide. We use the 2019 Community Health Needs Assessment that Good Samaritan Hospital conducts, and so the program was centered towards that resource itself. Um, we also made sure that our justification was also driven by past information from the data they had and also from past participants' experiences. Um, and so hopefully the goal was to make sure that this program would help educate and establish healthy behaviors. So next we're going to talk about the vision. And so the vision of Walk to Wellness is to improve the participants' health status by providing the resources and program to get a better understanding of what their health status is now and what it can be from the benefits of walking. And so now we're going to dive into our goals and objectives. So the first goal, we wanted to make sure we increase the number of participants and maintain the attendance through the 6-week walking program. So in doing so, volunteers from Oconee Valley Healthcare and St. Mary's Good Samaritan Hospital, we want to build those relationships within the community to promote the Walk to Wellness. During this time, we attended countless of meetings. We were able to attend poverty strategy meetings, family connection meetings, other events like the Julabee Festival, and just daily interactions within the hospital that community members will come into that we get to able to interact with. Another thing that we want to do is make sure that we want to provide a calendar of events and activities that we'll take during the program. And we want to make sure that if they had this calendar, this would help keep a reminder for them to stay motivated and to know what's going on so that they want to continue to be a part of this program. Our other objective was to maintain the attendance, and in doing so, we planned on using Everbridge, which is a mass communication software. And so what it does, once we collected the participants' information with their email and phone number, it gave them an option to see if they wanted that text reminder sent to them. And so they would be updated Monday through Thursday on the time to be there, the weather, and what was going on that day. If it was a Talk Tuesday and what it was going to be over, or if we had a surprise giveaway, we would also be using Everbridge to send them quick reminders. And then our second goal was to educate participants on the health behaviors of walking. And in doing so, we're going to make sure that the nurses and volunteers that we had at the pre and post assessment were when they were giving those assessments, we wanted to make sure that participants were understanding what they were getting tested on and what those results meant, and so that they knew the health status going into the program and what they could determine what their goals coming out of the program would be too as well. And then another way we wanted to educate our participants on the benefits of walking is our Walk to Wellness kickoff presentation on the benefits of walking, as well as some Talk Tuesday events that we have planned on the calendar as well. Our third objective is to improve the health status of the participants. So what we're going to do first is on March 24th, there is a pre-assessment. We chose to do the pre-assessment at Oconee Valley Healthcare because it is more centralized for the participants of Greensboro. And Greensboro, not Greensboro, excuse me, Oconee Healthcare has a waiting room and private rooms to do the assessments that the hospital does not have room for. So in these pre-assessments, we want to make sure that they're going to get tested on their blood pressure, cholesterol, glucose, BMI, and if those results came back alarming, we wanted to make sure that those participants were going to be flagged for further watch during the program, just so that we're aware if anything needs to happen, we know what to do and the reasons why, if anything happens. Another thing, we want to make sure that the participants will engage in physical activity at Robinson Park Monday through Thursday. And we're going to be able to track those laps that they do during 5 to 6 through their participant files that you'll see later on in the video. It breaks down how many laps they do per week. They will also have track record of that, but we will also do our own tracking on a separate Excel just to make sure that everything is fair game. And then the last objective is to complete a post-assessment. We want to make sure that we see a change in health status, and by doing so, we're going to do a second round of all those testings I mentioned earlier. And once we get a pre and post assessment, we're going to compare the status of each participant, and we're going to be able to send that to them via email. But at the post assessment, while all of them are there, we are also going to give a broad understanding tutorial of like how each test and the results and what you should gather from them. So now we're going to talk about the promotional materials. So we want to use a flyer, a newspaper announcement, and a radio station announcement. And then we used media. For media, we used a Facebook post and a video that I will show later for the pre-assessment. And then we decided to do a letter to the staff. So this is the flyer, and we wanted to make sure that this flyer was bright, fresh, eye-catching. We wanted to make sure that they had the clear facts that it's going to be a 6-week walking program. The pre-assessment is Oconee Valley Healthcare recently just changed their name while we were planning the program. So we still referenced Oconee Valley Healthcare as TenderCare, just to make sure that everyone understood what was, that it was still the same place. And then when the walking program would start. And then we just want to make sure that participants knew that St. Mary's and Oconee Valley Healthcare are really here as a support system, and that we want to make sure that you're on the right steps to a healthier you. And so next we have the newspaper and radio announcement. Basically, this needs to be really short. Luckily, because we teamed up with Oconee Valley Healthcare, they were actually able to use their resources and their connections with all the newspaper, the newspaper journals and the radio station Doc 103.9. So we actually didn't have to pay for a print in that or for the radio station. And basically, this just wanted to be a quick little blurb about how there's a pre and post assessment, and that there are new activities to be implemented into the program. So that's what that covered. For the Facebook post, this went a little bit more in depth because we thought we could put more in a post that someone would be more willing to read coming from a hospital. And so we also wanted to use Facebook because this is just another platform to reach more people and for this to get shared, because media has such a big hold on how information is getting passed around. But so this post goes a little more in depth about what the pre and post assessment will be about, and the health benefits of walking are also discussed further in this post. Next, we have a letter to staff and volunteers. This was sent to Oconee Valley and Good Samaritan staff. And the reason why we wanted to send a letter to the staff was we wanted to make sure that, it's me, Claire, and Miss Brown, who are the community outreach and benefit team. And so we wanted to make sure that the whole hospital knew that this is something that we're getting involved in, and that if staff were asked about this in the community, that they would be able to support and be educated on this program. So we sent this letter via Everbridge to all the staff to be educated. We also made an announcement at a staff huddle meeting that discussed that we wanted volunteers, we wanted them to be participants as well, and that if they could do their part and help us spread the word about this program, we would be great. We would greatly appreciate it. And next we have the timeline. So from the get-go, we pretty much knew that we wanted to do this program, like I said earlier. So we got in contact with the Oconee Valley Healthcare Communications Director, the Community Health Director as well. And so we met with Laura straight on. We presented her with our program plan, and then we got going. We made sure that we wanted to really reach out to the community, which is why it took a big portion of our timeline. And also we wanted to make sure that we were able to promote Walk to Wellness without it getting lost in like people's minds. So we had a hard time. We went back and forth with our timeline a good bit when we wanted to send it out. We thought about doing 2 months before, and then we decided that we wanted to do 1 month before to pass out all flyers and announcements through the newspaper and the radio station and Facebook, because we wanted to make sure this was still a fresh posting in people's minds. I think when you hear about something for so long, sometimes it can just get kind of lost, and it's not as urgent on your mind when you see something that like gets your attention right away and that you see that it's coming up soon, so it doesn't get lost. But this was our planning portion, and we thoroughly did our best, and it really set us up to get ready for implementation. Next is implementing the program. And so what we're going to talk about right now is the pre-assessment and the walking kickoff. So the pre-assessment would have been held at the Oconee Valley Healthcare Clinic. It's closer to downtown Greensboro. This space had separate private rooms to do the pre-assessment evaluation. an assessment, and it also had a waiting area that we were able to play a video that I will show in a little bit. But some of the information that they received in a packet while they were at the pre-assessment was the Walk to Wellness questionnaire and pre-assessment form, the physical clearance form, the body composition screening sheet, the consent to publish photo and video, and the Good Samaritan screening, and Oconee Valley Healthcare waiver. And so that looked like this. So what you can see here, the Walk to Wellness participant questionnaire covered the the participant's name, age, date of birth, gender, race. We asked for their contact information. We also asked their lifestyle and behavior. How do you rate your current health? How often do you exercise? Then we wanted to get some more qualitative data. Like, what kind of exercises are you doing? What is your opinion on exercising and eating healthy? What motivated you to signing up for this program? What are you most interested in? And then next, we wanted to look into their employment. Next, their medical information. We wanted to make sure that that we were covering all prior health history, any other health conditions that we need to know about. Next, we asked that we wanted to get the 3 short-term goals and long-term goals, and then they were asked to do the pre-assessment. And in that pre-assessment, you can see that they were tested on blood pressure, their pulse rate, their glucose, their A1C level, which is their hemoglobin, which basically, if your hemoglobin, a normal range is between 4 to 5.6, and if it's any higher than that, then your chance of diabetes increases. And then next, we looked at their cholesterol, their HDLs and their LDLs, their triglycerides. Next, we did their body composition, their BMI, and then their fat percentage. And so they were given that, and we wanted to make sure that when they were getting these assessments done, that the nurses and the volunteers that were giving these assessments were as health literate and transparent with what was going on and how, like, what their health status meant going into the walking program, because I feel like the more you understand, the more you're driven to get something done and accomplish it and stay motivated during that. Next, we have the other forms that I mentioned earlier. Consent, body composition testing, basically just giving them more resources, more information about what their health status is, and so they can use that. So next we're gonna, oops, I forgot that I wanted to play you that video that would have been going on during the during the waiting room. This video would have been played. So that video would have been played in the waiting room at Oconee Valley Healthcare. Um, but moving on. So the walking kickoff presentation would be is going to be held at the Robinson Park on March 25th. Um, this our audience for this presentation is the Walk to Wellness participants. The purpose of this presentation, brochure, and the information that I will be showing next will be used for for a resource for them during the program, and just to help them be educated. So this is the calendar. This is the March and April calendar, and so this gave us the opportunity to be creative for this program and plan these events and activities. And so what we wanted to do on Mondays, we wanted to have a Music Monday. We were planning on bringing a speaker to play music that they requested during their walking hour on Mondays. On Tuesdays, we made a Talk Tuesday, and on these Talk Tuesdays, it's planned to have someone from the community or the hospital come and talk about a different health topic that we thought that it would be important that they're also educated on, other than just the benefits of walking. So the first presentation that would have been given was on March 31st, and this would have been given by Cindy Davis, the PT and Rehab Director, and she would have given the presentation on fall prevention. The next presentation would have been given by Dr. Lang. He is a new physician there, and he reached out to us actually about after we gave out the letter about the program to the staff. He reached out back to us asking if he could come give a presentation on exercise prescription and Sacropina. And basically, he also wanted to do this because he is looking for more patients to take on. And so he gave out he was planning on giving out his card information to be their primary care physician. Next would have been April 14th. This would have been about mammograms and breast examinations. This would also give, because majority of past participants have been female, we thought it'd be important to give some women's health education. So this presentation, Ms. Kraft would have focused on getting a mammogram at the hospital, but if you can't, if you don't have the means to get a mammogram, you can do self-examination, and she would have demonstrated and provided resources on that. Next, it was April 21st, and Bodyplex was planning on coming to give a presentation on other physical exercises, and this would have been tailored towards an age demographic that needed assisted equipment to help do the exercise. And then last, our presentation would have been given on nutrition by Ms. Angelina, who is the nutritionist at St. Mary's Good Samaritan Hospital. Next is our brochure, and this would have been given to the participants as well. Because we were at the park, there's not really means to have a virtual presentation. So actually having the brochure really worked out well for us. It also would have been given to them to keep for further references later on. And so, So basically this brochure covers heart health, hypertension, and mental health. But basically, I would have given a presentation, and Claire and I both continued the presentation, further going into detail that, 30 minutes a day of walking. It can increase your cardiovascular fitness and strengthen bones, reduce excess fat, muscle, increase muscle power and endurance. Walking every day can also reduce your risk of developing other heart diseases, type 2 diabetes, osteoporosis, and some cancers. Because walking is so low impact and you can do it with no equipment, we also like stress that you can also take walking at your own pace to make sure that you're not stressing your body out too much. We also want to stress that um, we're trying to get walking into your daily routine for the next 6 weeks so we can change your behavior, so that you can change these health outcomes. And next, I'm going to talk about heart health. And basically, what I want to touch on is that by walking an average of 30 minutes a day, you can lower your risk of heart disease. You can lower stroke by 35% and type 2 diabetes by 40%. Um, and heart disease and stroke are one of the two leading causes of death in America, in the United States. And by regular physical activity, like we're saying, just focusing on walking, can also lower your blood pressure and improve your cholesterol levels. So next I want to talk about hypertension. And hypertension is high blood pressure, and that is a condition when the force of the blood against your artery walls is too high. And so um, hypertension, so when you're looking at your blood pressure and you get, let's say hypertension is classified as 140 over 90. And so that top number is your systolic pressure. And that's the amount of pressure your arteries, the amount of pressure in your arteries during contraction. And so that bottom number is the number, um, the amount of blood pressure when your heart muscle is waiting in between. So that's going to be a lot lower. Um, so hypertension is one of the most common, costly, and preventable cardiovascular risk factors. Walking can lower your systolic blood pressure, that top number we were talking about when your heart is contracting. And basically, that's just something that we wanted to touch on. More importantly, from heart health is hypertension, because it's just such a big risk factor. And then lastly, we're going to touch on mental health. And so a good walk can do wonders for your mental health, your mental well-being. It improves perception, self-esteem, mood, sleep quality, and also can reduce your reduce, sorry, excuse me, it can reduce um, your stress and anxiety. And so basically, when we're walking, we produce endorphins, and those are hormones that make you happy. They put you in a good mood. And so when you produce those, that can also improve your sleep and your release muscle tension and reduce inflammation. Um, and taking a walk gives you a chance to take the time out of your day to think and self-reflect. We also realize that this walking program creates like a community, a inner circle community, a team, a support system. And this is like a social aspect for you guys that we want you guys to get out of and continue to take walking with these people outside of this program. And so Claire is going to discuss the rest of the information.
Hey guys, so I'm going to jump back in. So something that Elena and I talked about before this program and something that we're both really passionate about is health literacy. So I'm sure you guys are all familiar with health literacy, but it's just kind of the capacity of an individual to understand their health related needs, understand what's being told to them by any kind of healthcare professional, and just ensuring that they understand what they can do, what's happening for them, where they can get resources. It goes on and on. So we're both really passionate about that because people can kind of fall through the cracks, especially lower income people or people with less education, can be told things or have programs done for them and not really understand what they're getting from it, and that kind of prohibits them from being able to make changes in their life, as well as people who do have a better understanding. Um, so we made packets for everybody, all the participants of the program, um, just to kind of keep track of what their scores were, and keep track of where they wanted to be and their goals and how this program was helping them. So this is an example. So you'd get a packet. The participant would, of course, put their name on it. And we put some of the benefits of walking regularly on this packet just for them to reference, and kind of find motivation every time they needed to come to the program. And Elena and I would have given a deeper presentation on a few of the health benefits that affected that group specifically and gone into a lot more detail. But on this packet, we just included a few. And of course, we put some tips for a healthier you too. So just kind of some other things to reference that we would remind them on days that they were walking, but just to have something to look back on when they weren't with us. And of course, we hoped that they would continue this walking by themselves or with a small group after the program and continue walking for 30 minutes, an hour every single day or most of the days of the week, to get the best results that they could. And of course, we had our pre-assessment, where we would have had our pre-assessment. So that's this other side, which you're being shown. And participants, we would fill this out for the participants, but we would actually fill this out with the participants by their side, just to kind of give them an understanding and actually have the healthcare professionals, the nurses, and the volunteers who would have been here explain these numbers to them, because that's a huge part of health literacy, is just saying, your blood pressure is this, and someone with no education in health or no explanation would have no clue what that means, if it's good, if it's bad, what they need to do. So actually sitting down with one of the healthcare professionals and having these numbers explained to them, and setting goals and saying what's healthy, what's not healthy, what they can do to change it. So we've got blood pressure, pulse rate, glucose, A1C level, total cholesterol, triglycerides, HDL, and LDL. And then some of that would be from the blood work, and some of that would be from other just health related stuff. And then body composition, so their weight, their height, their fat percent, their BMI, and their classification. So this would be for them to reference, of course, with the post-assessment and just get an understanding of their health currently, and what the goals they need to have are, and how they can accomplish those. And then, of course, the same for the post-assessment. So this would be after the 6 week of walking, to see how their scores changed. And again, have a healthcare professional actually sit down next to them, go through the numbers, explain this is better, here's why, this is the same, here's how you can help that, or maybe it was fine in the first place. And this was definitely to just help them get an understanding of their health, and also to encourage them to keep up, because if they can actually see these numbers right in front of them and see that this walking every single day is really making a difference in my health, and here's the proof, then that would hopefully encourage them to keep it up and keep going, and participate in the following years, and participate even when the program wasn't going on, bring their friends, bring their family, and so on. So this is more into the packet. So we did some walk to wellness goals. So as you can see on the left side, I'm choosing to walk because. So this might be, because I want to lower my blood pressure, because I want to lose weight, or it could be, because I want to be there for my granddaughter's wedding or something more personal. That was, of course, up to the participants, but just to give them something to remind themselves. Motivation can be a really hard thing with exercise. We all know that. You never feel, you always feel good once you get it done, but it can be hard to actually go out there, drive to the walking program, drive to the park, walk your hour. It can be hard to get that motivation sometimes. So this was just a reference. This is why I'm doing it. So we had short-term goals, maybe that would be to be able to walk a mile or to be able to walk 30 minutes without stopping or something like that. And then long-term goals, that would probably be more of the health-related issues. So to lose 5 pounds, to lose 10 pounds, to better manage my diabetes. So that would be something that would come in the 6 weeks of the walking program, but would also come from gaining this habit, getting this habit and sticking with it. And then we also had a way for them to track how much they were walking. So that's just always good to see. We would be having this information. So one of us would have been sitting or walking with them, but just keeping track of every single participant, what days they came, how far they walked, when they started, when they stopped, and convert this into actually miles at the end of the time. But to have them be a part of this was really important to us, and have them understand where they're at, to help better accomplish their goals. So we've got the days of the week. They could say, hopefully they would come every day, but not every participant would have come every day. But when they did, the minutes they walked, so, it was 5 to 6, but if somebody didn't have work or got off work early, they could come earlier, keep their track themselves when we weren't able to. If they wanted to stay late, stay late. If they did it on a Friday or a Saturday, be able to keep track of that. They would have to add it in this chart, but be able to keep track of what we weren't keeping track of, just to be able to reference for themselves. And then we also did nutrition on the side. So this is something that we couldn't really keep track of ourselves, but just to, if they see that check mark there, they might go in their fridge and get another fruit when they wouldn't have, or go grab a banana or something, just to be able to make that check in to, accomplish a goal for their day. And then we also did, how did you feel when you were walking? Are you noticing progress? So this is something that, it can be so gradual that you can't really sometimes notice unless you've been keeping track of it. So maybe at the end of this, they feel great after walking a mile, 2 miles. They can do it not without stopping, or without stopping, just a couple times. And so this would be able for them to look back and say, wait, I feel great now. I don't really remember that I didn't used to, but I look back and I see, it was really hard for me to do this at the beginning, and now it's not. So that was something that we were definitely really excited about, and wanted for them to just be in the know, and to be in the know about their health, their progress, their goals, and not just have us have all the information and they're just kind of showing up and walking just because it's something for them to do, and not have a real reason behind it, because we wanted to encourage participation as much as possible, and we thought this was the appropriate way to do it. So then at the very end, just a congratulations, and this would be from our minutes or from theirs if they kept good track of it. You've walked this long, you walked this many miles, and it could sound like a really long time at the end of 6 weeks, trust me. So we actually, in past years, they've done, you walk to Atlanta, or put it in perspective where they really understand that, yeah, it was just an hour a day, maybe 30 minutes a day, whatever they could come out for. But in the long run, really made a big impact, and they really went a far way. And we also have resources at the bottom. So, we're not always going to be there. This is a 6-week walking program, and we hope that they do it. And they're not going to remember everything that they learned throughout the program, but having these resources, these websites that they can just go to, and get a refresher on information, get the most up-to-date information, and just to help them maintain a healthy lifestyle. So our evaluation. So we wanted to ensure that we did an evaluation on our own work and on this program. We've learned in school that that's really how you make a program better, improve a program, is by going back and looking and seeing, what did we do? What difference did it make? And how could we do it better in future years? So we broke this up into impact evaluation and outcome evaluation. So impact evaluation would kind of be more like what impact did it have on the participants, kind of more short term, and then outcome would be more long term, more on a broader scale. So, for impact evaluations, some questions that we would have asked ourselves were how many people participated. So, we looking at past years, what we anticipated would have happened would have been about 30 participants that came and stuck with it and consistently showed up to the walking program. How often and how far did people walk? So, in past years, and again, just in anticipation, most participants walked 2 miles a day for 3 to 4 days. So that would be coming 3 out of the 4 days of the week, every single week, or 4 days. So a lot of people in the past have come every day and been really encouraged. And then how many participants continue to exercise following the program. So this would have been something that we would have had to look back on. So we were really excited to actually build relationships with the participants and to of course we would keep up all their contact information, and we were really excited to keep a consistent relationship with them and say we're going to check in every 4 weeks until the next year, once a month, or every 2 months, whatever it may be, every 3 months, and just kind of get an understanding of how they're doing now, if they're continuing the exercise, if they've done more exercises, or if they've kind of fallen off, and hopefully checking back in will be a way to encourage them and just be accountable to them keeping up their exercise and keeping up improving their health. And then um, for outcome evaluation, based on past years and what we anticipate, we would have hoped that every participant had improved basic health scores following the program. So that would have been from the pre-assessment to the post-assessment, looking at those scores. And then, of course, if they came back for the next year's Walk to Wellness program, we would have been able to see again if they kept this exercise up. There probably would have been remarkable differences in their health, versus just 6 weeks, which we've seen in the past there have already been improvements, versus a year. Then that definitely would have been huge, and great for the participants' health and the community health overall. And then for outcome evaluation also, we would use the next year's Community Health Needs Assessment, CHNA, to see how the community's health has been affected by this program. So hopefully by this program consistently happening every year and just helping to change behavior in the community and encourage this exercise, and give these people more health education to see how it affects them, have them take it back to their friends, to their family, to the community, and have it spread. Hopefully, in years we would see that these top health, community health issues, like cardiovascular disease, diabetes, obesity, and behavioral health would be lower and would drop off the scale some. And, we wouldn't see some of the data that we've seen in the past being so affected. And hopefully in years that wouldn't be an issue in the community. Okay, so also a few things that we would change. So looking at the past years, we wanted to bring in a lot of new ideas and just kind of bring in creativity. And some things that we didn't necessarily get to this time, or we anticipated might have been issues again, that we would have changed. So this is kind of hypothetical. But one, ensuring that we keep that contact with all of the participants. So this hasn't been done in past years. There hasn't been a checkup, but we would definitely want to do that, check in. I don't know the timeline. We'd have to talk to the participants and see what they were comfortable with, just to keep them accountable, keep us accountable, and hope to encourage maintaining the exercise. And also we would want to reach out to all of these people to have them participate in the program again. So have those be our first people, and then, that's a way to network and for them to bring people that they know and for them to help spread the word, so that next year it could be 40 participants and then 50 participants, and, maybe even have to do more days or a longer program because there's so many people that want to do it. And another thing would be for the pre-assessment for people that started late in the program. So this was based on past years. So people that started not at the beginning of the program and they didn't have that pre-assessment done, we would want to ensure that they got this pre-assessment done. So that would be just coming into the hospital and having them get that blood work done. It wouldn't be at the same time as everybody else, but having those scores to compare at the end, we think is such a huge and important part of this program. And we really would ensure that they had those scores to reference, even if they started a week into the program or just a couple of days into the program. Just anytime after that original pre-assessment, we would definitely want to change that and ensure that they got it done.
I just want to say thank you for taking the time to go through this presentation with us on Walk to Wellness. And I'd also like to thank Claire for being a great peer during this experience. And I'd also like to thank Bria Brown and everyone else that helped us plan this Walk to Wellness program. And thank you so much.